Hello everyone, I'm Anas Al Ubaidi, and the topic for this session is integrated patient cases, the key topics. And it is within chapter 28 about review of cardiology and pulmonology scribing within the Certified Medical Administrative Assistant course program by ACMSO. Introduction. The integrated patient cases are a foundational component in the training of advanced medical scribes, serving as a dynamic educational tool that prepares them for the multifaceted challenges of real world clinical environments. These cases mirror the complexity of patient scenarios that scribes will encounter, combining elements from various medical specialties and healthcare activities. They aim to enhance scribe competency in capturing detailed documentation that reflects the intricacies of patient care, ultimately improving collaboration and workflow in healthcare settings. The role of integrated patient cases in scribe education extends beyond standard documentation practices. These cases facilitate critical thinking by requiring scribes to discern essential details from verbal exchanges, diagnostic data, and physical exam findings. By working through these scenarios, scribes develop the ability to prioritize information, formulate pertinent questions, and anticipate the documentation needs of healthcare providers. For example, in a case involving suspected sepsis, scribes must align patient reported symptoms such as fever and confusion with objective data like elevated white blood cell counts and tachycardia, ensuring these elements are recorded coherently and efficiently. Integrated cases also provide an excellent platform to refine multitasking skills. Scribes often manage multiple responsibilities simultaneously during patient encounters, including transcribing provider patient conversations, documenting diagnostic test orders, and noting treatment plans. Complex cases simulate this lively, demanding environment, equipping students with the skills to handle high pressure situations while maintaining meticulous attention to detail. By exposing scribes to cases that span multiple medical disciplines, this training also enhances their capacity to synthesize information from a variety of sources. For instance, a patient diagnosed with heart failure may require data input from cardiology, neurology, and primary care. A scribe must skillfully reconcile these contributions into a cohesive medical record that preserves the integrity of all provider insights. This requires not only technical knowledge of medical terminology and healthcare practices, but also strong organizational and analytical capabilities. Furthermore, documenting integrated cases instills a deep understanding of interdisciplinary collaboration, a vital element of modern healthcare systems. Scribes, as well, play a key role in bridging communication gaps among care teams, ensuring continuity and quality of care. Comprehensive and accurate records can effectively support provider decision making, reduce the likelihood of medical error, and improve overall patient outcomes. Key points: clinical thinking in integrated patient cases. Prioritizing clinical data, integrated cases often present a wealth of information, making it crucial for scribes to discern what is most clinically relevant. Critical thinking allows scribes to identify high priority issues such as vital signs of abnormalities or alarming symptoms. Example: for a patient presenting with fever, hypotension, and confusion, a scribe must recognize sepsis as a possible diagnosis and document related findings such as elevated lactate levels, positive blood cultures, and provider ordered stat antibiotics. Identify gaps in information. One key aspect of critical thinking is recognizing when essential details are missing. Scribes may need to ask for clarification or ensure follow up questions are documented when providers address significant diagnostic uncertainties. Example: if a patient reports recent chest pain but no duration or triggers are specified, the scribe must document this gap, ensuring further inquiries during the patient encounter. And here is a summarized diagram on dissecting integrated cases for clinical relevance. Evaluating diagnostic progression, scribes must document the connections between initial findings and subsequent follow-up tests or treatments. This helps track the diagnostic reasoning process and ensures a more complete medical record. Example, for suspected pulmonary embolism, the scribe should include the sequence of events such as symptoms leading to a D-dimer test followed by confirmatory imaging with a CT pulmonary angiogram. And here is a diagram summarizing the diagnostic progression for pulmonary embolism. Comprehensive documentation skills, accurate and detailed notes. Scribes must ensure that each component of the SOAP note, subjective, objective assessment, and plan is complete and precise. Summarizing key patient statements or clinical findings helps maintain the narrative of care. Example, a patient reporting intermittent dizziness should have details like timing, triggers, and associated symptoms documented, as well as objective data such as orthostatic blood pressure readings during the visit. Capturing multi-specialty input, integrated patient cases often involve input from multiple providers, documenting, documenting interdisciplinary recommendations while maintaining consistency across the medical record is essential. Example, for a diabetic patient with kidney failure, notes may include endocrinologists' recommendations for glucose control combined with nephrologist instructions on managing proteinuria. Adherence to coding standards, scribes need to ensure that the medical records comply with ICD-10 and CPT coding requirements. This ensures accurate billing and comprehensive documentation for insurance purposes. Example, a record for chronic obstructive pulmonary disease (COPD) exacerbation might require linking the diagnosis code to spirometry results, medication prescriptions, and a follow-up encounter plan. Synthesizing information from multiple sources, integrating diagnostic findings, advanced integrated cases require scribes to merge data from lab results, imaging studies, and physical exams into coherent documentation. This synthesis supports the provider in arriving at a diagnosis. Example, for a patient with hypoxemia, synthesizing arterial blood gas results, pulmonary function test data, and physical findings like cyanosis in the assessment ensures a well-supported diagnosis of acute respiratory failure. Aligning present and past records, scribes must reconcile current findings with historical data in the patient's medical record to create a comprehensive narrative. Example, for an oncology patient undergoing chemotherapy, linking current symptoms with previous lab trends or imaging results provides context that aids in continuity of care. Documenting complex clinical pathways. Some patients, particularly those with chronic illnesses, may follow intricate management pathways. Accurately reflecting these cases requires clear documentation of each step in care progression. Example, recording the escalation of treatment in a rheumatoid arthritis case might involve detailing initial NSAID use, transition to DMARDs, DMARDs, disease-modifying anti-rheumatic drugs, and eventual biologic therapy initiation. Supporting interdisciplinary collaboration, enhancing communication. Scribes document information that assists healthcare providers across disciplines in sharing critical knowledge about the patient. Timely and accurate recording supports effective decision making. Example, a pulmonologist's note recommending oxygen therapy for hypoxia might also include a cardiologist's input on managing associated heart failure. Facilitating care continuity, integrated documentation allows seamless transitions of care across providers and facilities. This is particularly vital during referrals or when patients are managed by multiple specialists. Example, a patient referred for bariatric surgery will require documentation of prior weight loss attempts coordinated with a dietitian and records of comorbid conditions managed with other specialists such as hypertension or diabetes. Reducing errors by integrating contributions from all members of the care team into a single comprehensive record, scribes play a crucial role in minimizing miscommunication and redundancy. Example, for a patient with a suspected infection, the scribe ensures that culture results noted by the lab, antibiotic plans from infectious disease specialists, and subsequent symptom improvements are all documented cohesively. Preparing for common challenges in integrated cases. Managing high volume data, integrated cases often involve a large quantity of information. Scribes need to effectively condense and organize key insights without losing context. Example, documenting a full day hospitalization from admission notes to discharge planning requires prioritization of essential events and decisions. Adapting to dynamic interactions, some cases change rapidly based on test results or patient responses. Scribes must be prepared to revise records promptly while retaining accuracy. Example, a patient in the emergency department presenting with chest pain may initially have a suspected myocardial infarction MI, which later changes to a diagnosis of gastroesophageal reflux disease GERD after normal cardiac enzyme tests. Balancing multitasking requirements, scribes often handle documentation while simultaneously tracking medication orders, lab results, and provider patient conversations. This skill improves efficiency and accuracy in real time settings. Example, during a trauma admission, the scribe might simultaneously document primary survey findings, list imaging orders, and note medication administration details. Next, we have summary tables. As here we have table on key steps and critical thinking of integrated patient cases, step description, example, importance, and then potential consequences if missed. Steps we have identify urgency, evaluate pertinent data, analyze subjective and objective, consider differential diagnosis, propose follow-up investigations. Here we have table on essential components of integrated documentation, component, function, example, benefit, risk of omission. Components, we have subjective information, objective information, timely updates, interdisciplinary input, consolidated assessment. Table on synthesizing information sources, source, primary role, example, importance, challenges. Sources, we have patient history, lab results, imaging studies, specialist notes, real-time monitoring. Table on common challenges in documentation and solutions, challenge description, example, impact solution. Challenges, overlooking subtle symptoms, excessive information overload, poor multidisciplinary coordination, missed follow-ups, misaligned chronological order. Table on interdisciplinary collaboration in integrated patient cases, specialty, role in patient cases, example, impact, risk if excluded. Specialties here we have pulmonology, cardiology, nephrology, infectious disease, and radiology. Next, we'll revise what we have covered via this lecture through some MCQs or multiple choice questions. Question 1. What is the primary purpose of integrating historical patient data into current documentation? Is it A, to limit the amount of new data being recorded? B, to connect the past and present for a more comprehensive understanding of the patient's condition? C, to reduce the need for additional diagnostic tests? Or D, to simplify the documentation process by omitting previous information? The answer would be B, as to connect the past and the present for more comprehensive understanding of the patient's condition, as integrating historical data helps provide continuity and context for current medical conditions, aiding providers in diagnosing and managing the patient effectively. Question 2. Which of the following demonstrates effective critical thinking in documentation? A, documenting every detail regardless of relevance. B, highlighting key clinical priorities while organizing pertinent data. C, ignoring peripheral symptoms to focus on the primary complaint. Or D, waiting until the provider gives a diagnosis before documenting any details. Answer would be B, highlighting key clinical priorities, as advanced scribes should document relevant information that supports diagnostic reasoning while avoiding unnecessary or irrelevant details. Question 3. How can capturing interdisciplinary recommendations improve documentation in complex patient cases? A, it simplifies the record by focusing on input from one provider. B. It reduces the amount of information scribes need to document. C. It promotes collaboration by incorporating diverse specialized insights. Or D. It limits the influence of specialists on the main provider's decisions. Answer would be C, as it promotes collaboration by incorporating diverse specialized insights, as including notes from multiple specialties, ensures that the medical record reflects an integrated approach to patient care, fostering improved outcomes and reducing errors. Question 4. What is the best response when a scribe identifies missing patient information during documentation? A. Leave the information out to maintain brevity in the medical record. B. Make assumptions based on prior medical history. C. Highlight the gap and ensure follow up questions are addressed by the provider. Or D. Add generic details to complete the record. Answer is C. Highlight the gap, as scribes are responsible for ensuring that all essential data is documented, which may include flagging areas where more information is required to develop a complete patient narrative. Question 5. Which strategy helps scribes effectively manage high volume data in integrated patient cases? A. Focus solely on the subjective section to streamline the record. B. Prioritize and organize key clinical findings while maintaining context. C. Document the entire patient interaction verbatim. Or D. Avoid objective details to keep notes concise. The answer is B. Prioritize and organize, as when managing large amounts of information, scribes should focus on organizing critical insights while ensuring the documentation remains comprehensive and coherent. And here we come to the end of this lecture. Thank you very much and goodbye.